Hello, I'm going to talk to you very briefly about how to write a linear multiple choice question that's a little challenging until you get the underlying concept. So why do we need to bother? Well, by making a linear stem, our test taker is able to process the information much more efficiently and therefore make many less errors when answering the question. Let's think about an analogy of a ward round. So an intern is going to present a case to her attending. What's she going to tell him? She's going to tell him that about the patient, what's significant in their past medical history, what's their current complaint, and then the results of what testing that they've done to date. And he's going to ask her, so what do you think is the diagnosis? And this is exactly the same in our question stems. We need to set the scene, then say what was done, and then ask the question. Or in a little bit more detail in a patient type case, give the sex and age, relevant history, presenting signs and symptoms, what was done, and then the lead-in question. What we want to leave our test taker with, once they finish reading that stem just the once, is that lead-in question, and they're going to take that question forth and they go and look at the answer choices and all the images. So what we don't want to do is ask the question, then say what was done, and then set the scene, because when we do this, the test taker has to go back and read the entire stem often to work out what the question actually was, and they're more likely to make errors. Let's look at a couple of examples here. So the first one on the top is the non-linear question stem. What's the most likely diagnosis? So they've led with a question. Based on this radiograph and MRI, then they've said what was done. In this 14-year-old patient, then they've said who it is, with leg pain and difficulty bearing weight, setting the scene there. The linear version of this is a 14-year-old patient presents with leg pain and difficulty bearing weight, so we've set the scene. A radiograph and MRI are obtained, we've said what was done. What is the most likely diagnosis? That is much easier to process than the other way round. Here's another example for non-patient case. So the nonlinear form is, ideally how many hours prior to the administration of IV contrast should an oral premedication regime be given to a patient who is at risk for an allergic reaction to IV contrast? So kind of a mouthful anyway, but also again, they've started with the question. So when we've changed this for linearity, it's in a patient who's at risk for an allergic reaction to IV contrast. We've set our scene there. Ideally, how many hours prior to the administration of IV contrast should an oral premedication be regimed? It's now linear. It's easier for them to understand and less likely to make errors. So just to repeat here, you need to set the scene, then say what was done, and then ask the question. Thank you for listening.